everybody. I'm Pat Monticelli from the Brewfield Chamber of Commerce. This edition of our Business Matters podcast contains a rebroadcast of our recent webinar about mental health and COVID 19 for families. Our presenter is Dr. Jessica Hawks of Children's Hospital Colorado, and this presentation has a lot of great information. We hope you find it beneficial. Enjoy.
Well, welcome everybody. I will just share a little bit about myself. I am a clinical child and adolescent psychologist. I'm also the clinical director of our ambulatory services here at Children's Hospital and the Pediatric Mental Health Institute. So I oversee all of our outpatient clinics, including here on main campus, as well as the networks of care. And then I oversee our partial hospitalization program for general psychiatric patients and our medical day treatment program, which is a school-based program for kids with medical conditions of sorts. So I have, I would say, broad interest and expertise in child mental health. There's certain things that I enjoy more than others, but as far as today's presentation goes, I am privileged to be a part of what's called the Speakers Bureau here at Children's Hospital, where I get a chance to be interviewed and present to various people out in the community, which is one of my favorite parts of my job. And kind of got on the interview train with COVID after it all started. And as a result, did a lot of research myself because I wanted to make sure I was well educated as I was being interviewed. And I learned a lot about what can be helpful for children and families that feels very much in line with what I would recommend in other kinds of stressful situations, but with some unique recommendations specific to COVID. So since it is such a small group, I would be very happy to have this be more conversational versus you guys just listen to me blab for an hour. So please feel free to chime in with questions or comments as we kind of go through things, or if there are specific areas that you want me to address as we're talking through things, please feel free to do that. I'm more than happy to talk about anything, even if it's not specifically on the slides. So all right, with that, we'll get started. Let's put the PowerPoint in play mode and move that over. All right, so I thought I would start by just talking about some of the unique challenges specifically that families are going through and kids specifically, just because I think it's important to give visibility to what kids are grappling with. Some of this will seem like really obvious and something that's been covered a lot in the news, but some of it might be new information. So there's really three different areas that we're seeing as far as unique challenges go in the mental health world related to COVID. One is that there is clearly a pretty marked increase in stress for everybody, but there are certainly unique stressors for kids and a lot of anxiety for kids, especially those that had premorbid mental health concerns. We're seeing a huge uptick in the amount and severity of anxiety symptoms in kids and teens right now. And there's a broad reach, I would say, as far as what they're anxious about. There's certainly just the inherent worries and fears about COVID, getting COVID, having family members get COVID, people passing away from COVID, and a lot of just the unknown about how long this is all going to go on for, especially for our kiddos that either really struggle in school or are very high achieving. They're very stressed out about academics. What does the loss of academic opportunities mean for their long-term future? What does the future hold for them in general? And then parents are really being tasked with two different things. And some of you that are parents probably can certainly relate to this and probably add many other things to the list of what's stressful. But as we've seen in the news, there's been such a huge amount of adults losing their jobs and thus having a lot of financial instability. And that has a domino effect that we're even seeing here at the hospital now, because as people lose their jobs, they're also losing insurance. And so the ability to access mental health care is now becoming an issue because they don't have the ability to pay for it, which this is obviously a time where mental health access is going to be increasingly critical. And then parents working from home has been so stressful. I have been fortunate, I guess, in a weird way, that I've actually had to continue coming into the hospital because I can't even imagine trying to work from home. I have twin 7-month-old boys, and I would get absolutely nothing done if I was in my house. So I have so much empathy for parents who are working from home. I don't know how people are juggling all that. Then on more like the depression and mood concern area, kids and teens are dealing with a lot of grief, and there's different types of grief depending on the age. So Brenda, for your grandkids, the kinds of grief that they might be experiencing is probably more related to not being able to go out to the park or play on the playground, versus middle school and high school kids have a lot of grief about important milestones. So not being able to graduate from middle school or high school, not being able to do the signing of yearbooks the last day of school, or being able to say goodbye to their friends. And especially as kids get older, their social peer group becomes their most important thing in their life, and they've really become quite isolated. So I work a lot with families right now that are telling me that their teens just are saying there's no point in getting out of bed. There's nothing to look forward to. I can't go hang out with my friends. I can't leave. So why even bother? And so a lot of kids are sleeping really late into the day, which can also make their mood worse. And everybody's schedules have been all over the place, and that can actually cause a worsening in depression, especially for kids that were um, experiencing depression pre the pandemic. And then the last thing, and I actually read a article about this third point this morning, which was really concerning, but there is a lot more conflict between family members right now due to all the changing dynamics. Parents were in a place where not only did they have to work from home and be a full-time parent from home, but they also had to be extensions of educators for several months. And hopefully we'll be able to figure something out so that kids can go back to school in the fall and that burden won't be on parents. But that really caused a lot of stress for a lot of parents that I worked with, for a variety of reasons. So with increased conflict, one of the things that we worry about, and that unfortunately we have seen here at the hospital, is that there is a lot more risk of child abuse. So we've actually seen a tripling in non-accidental injury of kids during the pandemic, which is really heartbreaking. There's also been a real uptick in accidental injury. So there's a lot of people that are having to take their kids to the hospital just because they've hurt themselves more, probably because there's a lot less supervision as parents are trying to juggle everything, and kids are doing what kids do, and jumping off trees or doing whatever and end up breaking bones. But what's really concerning to me is that we are having this really high increased amount of physical child abuse with kids. So that's something that, for those of you that are working out in the community with families, something that I think is important to ask families. Obviously, not just are you abusing your children, but are you feeling that the increased stress related to the pandemic, is that causing it to feel more, does it cause it to feel more difficult to manage your children? Are you finding it too much to manage your children? That kind of a thing. And kind of going from there. But it's really important that we're asking those questions.
Jessica, I'm curious if you have any sense of what the actual increase is. That is, a lot of that increased child abuse, spousal abuse, is probably unreported because people aren't going to school, aren't going to work, others aren't observing those injuries. Is there any, I mean, there's no way to really track that, but do you have any sense of that?
I don't have a sense of the numbers, but I 100% agree with you that the tripling statistic is likely not accurate. It's probably actually a lot more. That's something that we certainly worried about in the mental health field, because you're absolutely right. We can't access some of these kids because they're not going to school, they're not going to daycare, and that is really concerning. And you're also right that we are seeing an increase in domestic violence as well, which is obviously really concerning because those individuals aren't always able to access the help they need because they're also isolated at home. So it's definitely very hard. And unfortunately, this pattern is not unique to COVID. We see this pattern every time we have a crisis of sorts, where there's a lot of stress in the home, especially families that have already been involved in the system or that already have a history of engaging in child abuse or even just corporal punishment. Unfortunately, when you add the stress that's inevitable from something like a pandemic, it taps certain parenting resources, and they're likely to revert back to old patterns, even if they've worked really hard to get out of those.
Yeah, but Broomfield Social Services has said that their investigations are way down.
Mm-hmm. Yep, I'm not surprised by that because, you know, a lot of people that make those reports are folks like myself who have not been able to see as many families or educators. So yeah, it's something that weighs heavily on me in my mind of how many of those kids are we not able to support in the ways that they need right now. Any other questions, comments about this slide? Okay. So also just wanted to kind of highlight some of the warning signs that we want to think about for child mental health concerns during the pandemic. And this is certainly not an exhaustive list, but these are the kinds of things that you want to be looking for more than anything else. So the first thing we know is, more than anything, the best predictor of future mental health concerns is past mental health concerns. So any child or teen that's had a history of mental health concerns, even if those have resolved, they are more at risk of experiencing an uptick in them again. Unfortunately, we've seen that here at the hospital. We have seen a huge uptick in the number of suicide attempts of teens over the last couple of months. And what's particularly concerning is a lot of these suicide attempts have been more potentially lethal. So they end up in our PICU, our intensive care unit, because of the severity of their suicide attempts. And our inpatient psychiatric unit has been at capacity the entire time the pandemic has been in place. So we know that we're seeing a mental health crisis on the tail of the pandemic. Other symptoms that are important to know: a lot of times kids and even teens that are experiencing depression don't look the way that we think of depression, and the way that adults will sometimes present with depression, which is more tearfulness or sadness. They oftentimes present as more irritable and just more grouchy in general, which is hard to distinguish between just like a typical teenager, but it is even worse for those that are experiencing depression. As far as anxiety goes, it's more intrusive thoughts and worries. So the way you can identify this is that a kid or a teen is constantly asking or seeking reassurance from an adult, questions that they've maybe asked every day for the last month, but they ask it again. And there's this easing of the anxiety as they ask about it, but it actually makes the anxiety worse in the long run. For younger kids, more childhood and younger kids, we see a lot more acting out right now, a lot more tantrums, a lot more physical aggression. Siblings are fighting much more significantly right now. Some of that's normative, but when it feels like it's excessive and every day, it's something to be mindful of. Changes to sleeping and eating habits. This can both be a risk of developing mental health concerns as well as a demonstration of mental health concerns. So it's a bit of a vicious cycle. If they're isolating more, so spending a lot of time in their room, they seem less goal-oriented, so they're not really interested in going out and hanging out with their friends or engaging in activities they may be used to enjoy, like going out and playing basketball or riding their bike around the yard or around the neighborhood. Some kids are having a really hard time feeling motivated to do any of those things. So again, not a comprehensive list, but these tend to be the most common mental health concerns or symptoms that you can see as warning signs that something is brewing underneath the surface. Anything that's not on the list that you feel like you would add that you guys have seen, or anything that surprises you that's on this list?
Jessica, I don't have anything to add or no surprises, but kind of a different thought comes up, given the, and this would, in theory, apply more to families of color, but are you seeing anything related to the Black Lives Matter movement? I mean, there's obviously that's in the news. A lot of families are going to these rallies. I don't know if that's, if you're a family of color, that could be very concerning, right?
Absolutely. You know, you bring up a really good point. I think it's important that we are talking about this, you know, regularly. So we know that individuals that come from any kind of ethnic minority group are already at risk of a lot of health disparities. So they were already more at risk of actually getting COVID. They were more likely to die from COVID. They're more likely to be losing their jobs. So they're more likely to lose their insurance and have less access to healthcare. So there's a lot of additional stressors that ethnic minorities and certainly the Black community has experienced that, as well as other ethnic minority groups, including our Mexican and Latino families. Whenever you think of a crisis or a stressor, when we have stressor upon stressor, it can add and accentuate even more so the potential of child mental health concerns. So especially for individuals in the Black community that are experiencing not only the pandemic, but now feeling a personal connection to the deaths of Black individuals and the riots and the fears that have gone along with that. And they are definitely, I think, again, experiencing certain parts of these major crises or stressors in a much more significant way than other individuals who might have some protective factors that make it less impactful for them. Great question. Any other questions that people have about this slide? All right, so let's actually talk about what do we do to help support kids and families. The number one thing, if you take anything from this presentation that I want you guys to remember, it would be that anytime there is a difficult topic to talk about, as adults, we tend to shy away from wanting to talk about it with kids. And there's a variety of reasons that we do that. Many are very well intentioned. A lot of it is that we think that if we talk about it, we're actually going to be planting worries or fears or ideas into kids' minds. And so a lot of times we think that we're shielding kids from the stress by not talking to them about it. This is also true of suicide in general. Parents tend to not want to talk to their kids about suicide or check in about those kinds of things because they're afraid that if they ask, that somehow they're going to be planting an idea in their mind about suicide. But we know the opposite is true, including for COVID. Kids know everything about COVID, whether we want them to or not. It is impossible to avoid. And part of that is that like their whole lives have been turned upside down. You know, they're not allowed to go anywhere. They weren't able to go to school. They have to wear masks now when they leave the house. So obviously they know something is going on. The other thing is that it's everywhere. You can't go anywhere or turn on the TV or get on the internet without seeing something about COVID. So kids and teens are aware of COVID. And as adults, what we want to do proactively is discuss this with kids, because when we do that, we are able to address the concerns that kids are likely already worried about, but may not be verbalizing independently. So adults need to think about approaching kids about this and engaging in this in an ongoing way. So it's not a one and done conversation because as we all know, this is an evolving situation for all of us. So the worries that were, I think, at the center 2 months ago are not the worries that we might have as much now, but there's new worries. So we don't want to think about this like, well, I checked this off on the box, like I've talked to my kids about it, we're good. It really should be an ongoing conversation. And when we approach kids, if they say, I don't have any questions, I don't want to talk about it, that's also okay. By approaching it, you're letting them know that the door is open to have that conversation, but we don't want to force kids to have the conversation because that can actually be more damaging than helpful. So the most helpful kind of approach to take with kids when you're talking to them about COVID or any sensitive topic is to take cues from them. So rather than saying, you know, hey, let's sit down and I want to share some things about COVID, you sit down with the child and you say, you know, I know you've probably been hearing a lot about coronavirus or COVID. What kinds of questions have come up for you? What are you wondering about or worrying about? And just leave some open-ended questions for them to share. Now, some kids might need a little bit more targeted questions. So they might need something more like, are you worried about your friends, or are you feeling sad about not being able to see your friends, versus just how are you feeling? It kind of depends on the kid and their age. And I'll talk a little bit about age appropriate here in just a second. But you want to take cues. So I'll break down the broader conversation a little bit based on age. So early childhood is really like 5th grade and younger, approximately, because every kid's developmental level is a little different regardless of their age. But in early childhood, the focus should be on a very brief conversation, a very simple conversation, and focused on reassurance. We want to make sure that when we provide reassurance, however, we're not giving empty promises. So something that I saw a lot of parents doing at the beginning of the pandemic before everything got shut down was they were telling kids, like, I'm sure we're going to be able to go back to school in a couple of weeks. And this was before we really knew what was happening. And obviously kids did not get to go back to school. And so then they start to become less trusting of everything that their parents say when they give promises that they aren't able to keep. So we can't promise, for example, to a young child that nobody that they love is going to get sick. There's no way for us to know or predict that. What we can reassure them is that all the adults in their life are doing all that they can to keep themselves and others safe. So you want to provide that reassurance. You want to focus on the things that can be in their control. So saying things like, these are the 3 things that we're going to focus on as a family to make sure we stay safe. We're going to use social distancing. And we wouldn't use actually those words with a young kid. We're going to make sure we keep space from other people. We're going to make sure we wear our masks out in public, and we're going to make sure we wash our hands. And focusing on those tangible, concrete things that kids can do can be really helpful. In middle childhood, the most important thing to think about with these kids is that they engage in a lot of developmentally normative cognitions. So they do something called magical thinking, where they think that their behavior actually influences things outside of their sphere of influence. So they might think that if they act up at home and fight with their brother and then grandma gets sick the next day, that somehow that's their fault. And so one of the things we want to make sure that we do is dispel some of that belief and also help them differentiate myth from fact. So there's a lot of misinformation out there about COVID. Certainly information that's been presented in certain news outlets or on certain websites that just is more scary than informative. And we want to make sure that we're shielding them from that type of source as much as possible. But this is, again, where it's helpful to follow their lead. So you can say, what do you know about COVID? What have you learned so far about COVID? And you start to just ask them what they know, and you'll start to see the things that make sense and are actually based in fact, and what might be things that they've created in their minds just based on their cognitive development. And then with teens, the most important thing to do is just to be actually pretty transparent. Our teens in this day and age, with the level of access to technology that they have, they've been able to read and listen and hear a lot more information than probably has been helpful. So you want to have a pretty candid conversation with them, be honest, be accurate, and provide factual information. One of the things that can be helpful for teens is actually to guide them to websites that can be informative. The CDC website actually has a really good family-facing website that can provide helpful and factual information versus Dr. Google, which can sometimes provide a lot of information and not be as helpful. I'll stop there. Any questions specifically about what I just shared as far as the kind of general approach to take when you're initiating these conversations? All right, excellent. Well, then let's move on to the other parts of the slide. So other things you want to do, as adults, we like to solve problems for kids, and especially when they're in distress. And so one of the things that I see a lot of parents doing right now is that when their kids are exhibiting fear and anxiety or sadness, parents kind of immediately jump in and want to solve that. So they'll problem solve about, like, how can we have contact with our friends or our family, or how can we plan some fun outings? And those things can be incredibly helpful. And they're more helpful if the first thing an adult does in that kid's life is empathize. So just by labeling the underlying emotion that you're sensing from the kid or teen can be incredibly powerful for that child, because they, one, will feel heard. And simply the act of feeling heard can actually lessen emotional intensity that they're feeling. And it helps them, especially younger kids who might have less well-developed emotional language, it helps them to be able to label for themselves how they might be feeling. So you're able to kind of model some of that emotional language. So saying something as simple as, it sounds like you're feeling really sad that you're not going to be able to go back to school and see your friends this year. Or what I'm hearing is that you feel really worried that grandma and grandpa might get sick because they're older. So just saying those kinds of things. The great thing about empathy is that if you get it wrong, your kids or the kid you're talking to, they will let you know. And that's actually okay if you don't get it right. It's just the act of trying that is most important. And then once you've done that, then you can jump into problem solving and help kind of think about how they can be better supported. Already talked about the being reassuring piece. As adults, we need to deal with our own anxieties before we try to support our kids or kids in our lives. Because the number one way that kids learn is by watching. And so for better or for worse, if there is a child in our life that we are a primary source of support to them, and they see us really stressed out and really worried or glued to our TV, constantly wanting to absorb the news, they're going to do the same. So as much as we can, at least on the outside, we need to be managing our anxieties. Now, we can talk about the fact that we felt anxious in front of our kids, but we don't want to belabor it, and we want to focus on, this is how I'm feeling and these are the ways that I'm coping with it, versus just focusing on the anxieties themselves. And then the last thing we really want to do with kids when we're talking to them is, and I already kind of mentioned this, but just focus on the things they can control to stay safe. Because there's so many things about COVID that none of us have any control over, but there are a few things that we know can be helpful. And empowering kids and giving them some sense of control over the situation can be really helpful. Any questions about any of those secondary bullets?
Jessica, I would just comment that it is hard because information is changing so frequently. So sometimes, like if I feel like I'm providing accurate information in an age-appropriate way, I could still be totally wrong the next day. And I've run into that a couple times. Like, I have a 6-year-old, and we've been very reassuring to her that, like, even if she got this coronavirus, like, it's not affecting children, like, you might get sick, but it's not really, we're not worried so much about kids. And then just like yesterday, she said, I heard kids can die.
Yeah.
And I was like, well, so, like, it's not exactly the case. And I was like, oh, dang, now what do I say?
Yeah, no, that's such a great example, because you're right. I mean, even as a mother of young children, I initially felt much less worried until we started to see on the news the secondary kind of virus presentation that's happening with a subset of kids, and they don't know a lot still about why that's happening. So yeah, it totally freaks, I think, parents out. So certainly as a kid, it would be scary for them too. I think it falls into that kind of reassuring without promising a whole lot. So some of the language used is actually perfect, which is that it's not impacting kids as much. Versus like it's not impacting kids at all, or kids are never dying. You can say that in general, kids are getting less sick, but we don't want to promise any kind of absolutes, because you're right, like the information changes all the time. But it's okay if, like, more broadly information changes. That's part of why this is an ongoing conversation, because you're right, like the information is changing like every day. And so revisiting this with your kids and be like, hey, I know that such and such information has been being talked a lot more recently. I wonder what questions you have about that, because that feels maybe a little different than what we talked about last week. And just acknowledging that and being open with it. Kids are pretty savvy, and they can appreciate and recognize how things change, but it's when we don't talk about it, but they know it, that's when it becomes a problem. So your daughter had heard about it already, right? So it's crazy, like, where do they get this stuff? But they hear it from somewhere. So we should just always operate under the assumption that kids know, and approach them as though they do, and just have them ask the questions that they might be wondering about.
Cool, thank you.
Yeah.
I think one of the most interesting things, or maybe concerning, is that I have a 7-year-old granddaughter, and she understands what's going on, but just helping her understand why she can't do the things that she used to do is difficult. And why can't we go to the zoo, school notwithstanding? Why can't we go to the park? Why can't we go swimming? It's those sorts of conversations. Helping kids understand what this new normal is difficult.
It absolutely is. And I have found myself challenged as well over the course of these several months of, like, developing the kind of language that's helpful to talk to little kids about these kind of things, because it is very confusing. And I think it's become even more confusing as certain regulations and restrictions have eased. But different families have chose, based on their own values and beliefs, to do that differently. So some people are going to the park now, and they're not always wearing masks. And then there's other families that don't feel comfortable yet going to the park, or if they do, they are wearing masks and they are socially distancing. And so for a lot of kids, it's like, wait, I don't understand why Johnny down the street is at the park, but mom's not letting me go to the park. Like, how does that make sense? And so again, it's about having an ongoing conversation with your kids about the why, and being really thoughtful about the language that you're using. And it depends on the age of the kid and the kind of language that you use, but we certainly don't have to get into all the nuances of what COVID is and that it's a respiratory disease or the, whatever. We can just say that there's a new sickness out there that's making people really sick, and we need to do what we can to keep the germs away. And one of the things we can do to keep the germs away is to stay a safe distance from other people, or to wash the germs off our hands after we go out in public, or, whatever. But talking about it in a really basic way, especially for the age of your grandchild, is typically the best way to do it. But this is another opportunity where asking questions like, what are you feeling frustrated by? Or what are you feeling sad by? Or what are you feeling confused by? Then those conversations or those questions might come up, and then you can have a conversation about it.
Great.
And Jessica, how do you talk about risk factors, and at what age is that appropriate? I mean, some people think the risk is you look at somebody without a mask and you're going to be in the hospital with COVID, whereas others, saying, hey, it's only this percentage, it's so low, I have no risk. How do you talk about children, and at what age does it really sink in, the understanding of that?
Yeah, it's a great question. I would say that in general, I actually wouldn't initiate a conversation about risk factors. It would be following the kid or teen's lead if they're asking. So if a kid or teen, and probably be more likely that it would be a teen that might ask this kind of a savvy question, but they might say something like, what increases the chances that I could get it or that you could get it? And then you could talk about the risk factors. But this is where being transparent and open about the current state of the science can be really helpful. And again, using like kid or teen friendly language and saying like, this is a new sickness. We actually don't know as much about this sickness as we know about other sicknesses. And, adults that are scientists are doing lots of hard work to try to figure out more so we know what to do. But what we know in general is these things can sometimes make a person more sick. So what we know so far is that if you're older or you have some sort of problem with breathing already, those might make you more likely to get it. And just leaving it kind of at that. Or if you don't want to be too disclosing, which again, you have to strike that balance of not wanting to share too much because you might actually share things they weren't thinking about that will now make them more anxious. You can ask them, are there certain people that you're worried about that might be more likely to get sick? And then they'll be like, well, yeah, I'm really worried about, Aunt Susie because of blah, blah, blah. And then oh, okay, so what is it about Aunt Susie that you might be worried about? And then you can talk about whether or not she actually has a risk factor that might be relevant versus like going through the CDC risk factor list, which will probably be more information than any kid or teen needs to hear.
Jessica, I presume the potential of a second wave, either because we're going back to quote unquote normal too quick, or because the cold weather in the fall, I presume that's something you don't really want to raise unless they have questions, as you're suggesting. But, and this is an unfair question, but if that does happen in a big way, have you, even without making empty promises, has your reinsurance as a parent, have you undermined your own credibility?
I think the only way that we undermine our credibility is if we promise that this is getting better and it's not going to get worse again. So it's just about making sure that we don't promise things that we don't know, because we have no idea. It's possible. The modeling certainly suggests that we're going to see an uptick, but who knows? We don't know when we're going to get a vaccine. We don't know a lot of things. And so I think in general, I wouldn't probably share that at all with kids and teens unless they ask. And then if they ask, you can just share what it is we know, which is we're not sure. It's possible, and there's a lot of different variables that might make it happen or not happen, and we're just going to have to keep watching and seeing what happens. And these are the things that we can keep doing as a family to try to keep ourselves healthy, and always bringing it back to the things we can control can be really helpful and empowering for kids. Great questions, you guys. The last slide here, and then I'm happy to open it up to whatever other questions you guys might have, is just kind of some big picture recommendations as far as things that we recommend to families as far as how to best cope with COVID. So we've kind of touched peripherally on some of these, but I'll talk about them a little bit more explicitly. the number one thing that we're recommending to families is to limit the amount of news that you're exposing your kids and teens to. I know even for myself at the beginning of the pandemic, I like to watch the news anyways, so I was watching it every night anyways, but I got really sucked in and was watching it all the time and getting all the, Fox 31 News notifications on my phone about the number of new cases and deaths every single day. And it was really unhelpful. And I found myself getting more anxious because of the amount of information I was consuming. And kids and teens are going to be even more overwhelmed by the amount of information out there because there's so much out there. So don't have the TV on all day long with the news station is definitely going to be in everyone's best interest, including ours. So there's a kind of a delicate balance between being informed and being consumed. The other thing that can be really helpful for families is to make sure that the adults in a kid's life are available. Right now, parents and grandparents and aunts and uncles, everybody is juggling so much. And things are starting to settle a little bit into the new normal, but parents have been really preoccupied, especially those that have lost their jobs or that have had financial instabilities. And it's been really difficult for parents and grandparents and other caregivers to be available, but we need to be available to our kids so that they can ask the questions, like we were just talking about. We already talked about healthy modeling, so I won't go into this one too much other than just to reiterate, we know that kids model what they see or imitate what they see, so we need to be good models. The daily schedule piece is a critical one for kids and teens that I think continues to be a challenge. I actually ran a group this morning with parents who continued to express how challenging that this can be, but it's been a bit more of a free-for-all in many homes because everyone is just trying to survive and adjust to all the new challenges and stressors. And consequently, that has allowed certain things to slip that otherwise likely wouldn't have slipped. And that includes sleep schedules. Kids are staying up later, they're sleeping in later. There's a constant access to food. A lot of regular meal times have kind of flown out the window. There's all sorts of memes on the internet about us all gaining the COVID-15 and kids are the same. They're also having more access to junk food and food in general. So we need to be really thoughtful about how we schedule the kids' day for a couple of reasons. One, we know it's a really important protective factor against mental health concerns in general because there's predictability in the kid's life. Doesn't mean the kid likes it. They will oftentimes push back against it, but it's in their best interest to still have a schedule. The other reason that is a little bit more future forward thinking is that if we don't have a schedule at all and then we abruptly throw kids back into schedules this fall, there's going to be a huge backlash and a real difficulty, at least for a subset of kids, to readjust back to that. So we have to be thoughtful about trying to build a schedule in a way that can be helpful. We also want to make sure that we're scheduling in actual fun activities and not just focusing on survival. So we should be scheduling in things as a family that we can do, going on bike rides together, etc. And then finally, we've all heard about how socially isolated people are and how impactful that can be to people's mental health. And people have gotten really creative. I've been really impressed with some of the families that I've worked with and the kinds of things that they do. We have families doing dance off with family members. We have people doing, different like board games they're playing with other family members through Zoom. There's all sorts of fun things that families have figured out how to do, but we have to continue being creative and socially connect, even if we have to maintain that social distancing. And this last slide is just some resources. The Child Mind Institute is a phenomenal website for parents and families. They have live Facebook chats every day with parents to ask questions. There's a ton of resources and handouts. And then I am a big fan of Headspace and Calm. Both are typically apps that cost money, but both developers of these apps have offered them for free during the pandemic, and they can both be pretty great and engaging both for adults and for kids. So with that, I will turn this off and open it up for questions. What kind of questions do people have?
What were those resources? It was Headspace, and what was the other one?
Calm. And Calm is a mindfulness meditation app. And this woman who I think is Australian, they're always Australian. I don't know why that is in the mindfulness world, but she does a different mindfulness exercise every single day. And it's usually about 10 minutes. And it can be a really great way to start your day of just kind of centering yourself. And she has like a different topic or theme that she talks through every day. So it's different each day, but it's really quite well done.
Thank you.
Mm-hmm.
We have a new attendee. Welcome, Jill.
Thank you. It's good information. Really appreciate it.
Of course. And I'm happy to send out this PowerPoint to folks so that you guys have it. And, I'm not sure who the point, maybe Pat. Brittany can send it to Pat and you
That would be great.
welcome to
I could do
distribute
that.
it.
That would really be appreciated.
Of course.
So Jessica, I have a question. So I find myself in the position of having now to talk about this maybe with other people's kids, not just my own. So I imagine the guardrails or the guidelines are pretty much the same as what you outlined there, but I don't know, for some reason I find it a little more challenging because everybody's coming from a different point of view, a different family situation. And, you know, I just know some families are very nonchalant about how they feel about the virus, where others have good reason to be really careful about it, and they're bringing their kids to me in small numbers, but still, you know, like groups of 4 or 5 where the kids can interact and the conversation can kind of go down a rabbit hole. And, you know, I'm not trained as a group facilitator and I don't want to limit or censor their conversation, but I also don't want them freaking each other out, basically.
Right.
So I don't know if you have maybe some words or guidance, you know, not really knowing exactly what the question is, but just knowing that sometimes it's like a little awkward because I'm hearing kids talk and I want them to have a safe space to talk, but I also might kind of know in the back of my mind, you know, like this kid has a situation at home and the information they're hearing might not be getting heard the way the person speaking thinks they're saying it. And, you know, like trying to, like when to intervene and when to just kind of let them get their thoughts out, you know. I don't know if you have anything to say about that.
Yeah, it's such a great question and such a complicated one, I think, to answer. I think if you're having like a formal conversation with a group, whether it's parents or kids, I think preemptively just saying, you know, there's a wide range of ways that families are choosing and needing to cope with the pandemic, and there's not necessarily one right way to be managing and navigating it. It depends on a lot of different things. And so we shouldn't expect that everyone is going to approach this in the same way, and just try to kind of caveat that there's going to be differences and that there's good reasons for those differences. And we might not always know the reasons, but we should just trust that different families have different reasons for different approaches. I know that certainly has been something that's come up in groups that I have ran where different parents are sharing even just different beliefs about the pandemic in general. And it can also get very political. And so you have to really start to, I think when it gets to the place where it becomes political or people start to get emotionally charged, that's certainly a time when as a parent or an adult, we want to intervene, because when it gets emotionally charged like that, the conversation becomes unproductive and it usually just fuels frustrations or worries or anger. And I think as far as like, if you're hearing side conversations with kids, I think generally speaking, letting those conversations just play out naturally is typically the best way to go, unless you're hearing something that's like blatantly damaging. You know, so if a kid says something like, you know, I heard that there's like a 90% chance that we're all going to get it and end up in the hospital or something that's just like absurd, it would be appropriate to intervene in that position. But if it's more nuanced kind of conversation, I would probably just let them work it out in the same way that we typically let peers work out conflict, unless it gets like to a point where it's becoming aggressive and then we want to intervene. Any other questions, comments?
I think that your idea of having a schedule is so important. I've spent a lot of time with the Grand Boys recently helping out with the new babies and stuff. And if they're not focused, the older ones, if they're not focused on something, they are at each other. and they're only 6 and 4. It's like, why are you guys fighting? You're too young for this.
Right.
So I think having that schedule and keeping them focused on something, whether it's, you know, some kind of activity or some kind of game or something like that, is so, so important right now.
Yeah, I 100% agree with you. I think that it is really important and it can be tough to do. But I think if you can even just have blocks of time that certain things are supposed to happen, it doesn't have to be at like 10:15 lunch or breakfast has to happen. It can be just like in general, between 8 and 9, we're going to be dressed and have breakfast. So it doesn't have to be like crazy regimented, but having at least blocks so kids know what's to expect next can be really helpful. And we can absolutely include kids and teens in the generation of these schedules. And that actually can be really helpful for them to be being able to contribute to it, because then they're more likely to actually want to do it. So, yeah.
Not just children, adults benefit from having a regular schedule too. It removes anxiety.
Absolutely. Yeah, no, the recommendation of a schedule is across all ages. Because yes, absolutely. I know that I have heard a lot of that from the clinicians that I oversee, that they worked a lot of more working from home through telehealth. And while they initially really liked it, they started to find that it became hard because I think the social isolation, but also just the fact that things felt looser and they didn't necessarily have to get up and commute to work and do all the things that we're used to doing. And it definitely causes some distress.
How have you found the effectiveness of telehealth with your clients?
So I can answer that twofold. So in the literature, what's been published on telehealth suggests that the outcomes for telehealth are comparable with in-person visits, broadly speaking. I think anecdotally in my clinic, there are certain patient populations that benefit tremendously through telehealth, and there are other patient populations that benefit less well. So if you look at a patient population that engages in a lot of like externalizing kinds of behaviors, ADHD, oppositionality, those kids don't do well in telehealth because it's hard for them to sit in front of a computer and have a conversation. But it's also hard to get them in front of the computer. We have learned a lot of kids will just refuse to come out of their rooms. And so what we do is we shift the interventions to the parents and really help them and support them in how to help manage their child. But for some kids who are incredibly anxious, for example, and don't want to leave their house, being able to do telehealth, at least at the start, can be great. Now, ultimately, we want to get them out of the house as part of the treatment goal, but at least to start, it can be a good place to meet them where they're at. And I would say more broadly, just in the state of Colorado, and many of you will know this, especially out in Broomfield, because you are more rural, mental health access is a real issue in the state. And what's been awesome about telehealth is we've been serving kids in Durango and Aspen and all these places that we typically wouldn't be able to serve because they're too far away. And now these kids are getting access to evidence-based treatments, which is awesome. So we've been really excited about that. The problem is that telehealth regulations are going to go back into effect in August, and payers are likely going to stop covering telehealth again. Which I'm really hopeful that new efforts will be made to try to get telehealth progressing, because I think it can be a helpful adjunct service. I don't think it should be the only thing we're doing, but I worry we're going to just end up going right back to where we were if we don't try to push some of these agendas forward. So it'll be interesting to see what happens.
Is that federal or state legislation, Jessica?
It's a little bit of both. There are definitely federal laws that are overseeing, but there's also certain kinds of things on a state-to-state basis that are being decided. All right, any final questions?
Piggyback on that. At Mental Health Partners, I would say, well, we have clients of all ages, kids up to older adults, and I think for some of our clients, it's actually been a breakthrough, and they're doing better.
Mm-hmm.
And some of the problems with no showing for sessions,
yes,
that's actually probably decreased a lot, because it's like, I don't have to deal with transportation. I don't have to find childcare. I don't have anything else to do.
right.
So I will actually talk to you. And so I think we've seen a lot of success, and then there's still like a percentage, a smaller percentage where it hasn't worked. And so that's the piece that we're trying to figure out. Well, our plans are continuing to do telehealth predominantly, but also making a few exceptions and figuring out how do we do that safely.
Yeah. Yeah, I completely agree with you with the no-show rate. We have like typically about a 13% no-show rate in our clinic. And I think it went down to like 2%. It was,
Oh my goodness.
it was crazy. So, and it's another, I think, a great example of just access, you know, because
Right.
there's so many barriers, especially for certain families, to be able to access the childcare and the transportation to get to services. And so it's
Right.
great.
Gas money. Yep.
Exactly. So it's been really great to see some of those families that already have a lot of psychosocial barriers and stressors be able to more consistently access their appointments.
Thank you again to Dr. Jessica Hawks and Children's Hospital Colorado for making this presentation possible. Please like, share, and subscribe, and we'll see you again next time on Business Matters.